Okay, so we're going to talk about blood pressure monitoring by community pharmacists. I know some people might ask the question, what does a community pharmacist have to do in the role of monitoring hypertension? And that's what I'm going to talk about today. So hypertension, it literally means high blood pressure. They consider it one of the most important measurements in the clinical setting because of what it might lead to. Not necessarily having high blood pressure, but another disease that you might get from having high blood pressure, such as coronary artery disease, stroke, and possibly renal failure. Sadly, this is also one of the most inaccurately performed measurements. You would think one of the ones that is most important. We found a way to consistently make accurate measurements, but that unfortunately is not the case. And this is important because approximately 1/3 of our population have this problem. And that means 1/3 of our population is going misdiagnosed, undertreated, or overtreated because there's such a discrepancy when it comes to monitoring for hypertension. So this was released by the American Heart Association. This is the recommended values of blood pressure, what they consider to be normal, prehypertensive, stage 1, stage 2. And pretty much what that means, anything under 120 systolic blood pressure and under 80 diastolic blood pressure is what they consider to be normal. Normal is such a broad definition nowadays, but this is what we go by. Prehypertensive, obviously 120 to 139, meaning you don't necessarily consider to have a problem with it, but you're at that border. Stage 1, stage 1 is 140 to 159, stage 2 is 160 and over. Obviously, these measurements also vary with certain comorbidities like diabetes. The normal for having another disease with it, such as diabetes, is not necessarily going to be 120. So a problem that a lot of people also see is that 120 over 80 is considered to be the normal, but that's not always the case. And it's our job as community pharmacists to make sure people understand that too. And this is the different times of day, what your blood pressure should be. It varies throughout the day. Obviously, it's higher during the daytime and lower at nighttime. But if you notice like a discrepancy between these measurements, it's also important to tell people if should they come into your pharmacy asking, I took my blood pressure at this time and it was this. Is that okay? So knowing that different times of day also have to do with how your blood pressure is going to read is also important. How to monitor blood pressure, usually the traditional way is at the doctor's office. He uses a BP cuff and a stethoscope and he listens to it. Nowadays there are a lot of community pharmacies that also have either a stationary blood pressure machine where you could go up to it, take it yourself, or a pharmacist actually takes it for you with either the same thing or a tabletop machine such as this. And these are also available to use at home. And this is a picture of one of the stationary machines at a community pharmacy. So you can see all the different ways you can get your blood pressure taken rather than just the traditional way. Most people usually think the only time you get your blood pressure taken is your next doctor's appointment. And like I said, this is the traditional monitoring. We use a mercury sphygmomanometer and a stethoscope. And the technique they use is the Kharkov sound technique, where you listen to the blood actually going through the artery with the blood pressure cuff on. And that's we'll go over that later. Continue with traditional monitoring. Again, like I said, it's usually done at the primary physician's office. This actually has its own fair share of problems. One thing we've noticed is that it comes with a certain term called white coat effect, which when a patient comes into a doctor's office is not exactly the happiest place to be sometimes, especially if you have an elderly patient. They worry about this stuff. White coat effect literally means patients who feel anxious during the time of the blood pressure reading or the appointment in general, which obviously leads to inaccurate results. Why that's bad? If that's the only time you're taking your blood pressure, then obviously you're not going to get the right reading, which is going to lead you to either over-medication, because the doctor notices it's high every time you come here. So they'll either say, oh, your medication isn't strong enough, or they'll change you to something else. and therefore people are getting medication that they don't need. So they're being overdiagnosed and overmedicated. White coat hypertension is pretty much if the only time you get your blood pressure taken is at the doctor's office and you always have consistently wrong readings. Office blood pressure readings are consistently higher than out-of-office readings. Yeah, that's it. How to fix this problem? There's a couple ways to actually fix this. And that's just monitoring your blood pressure more than just in the doctor's office. Obviously, there are ways, like I said before, you could always go to a community pharmacy who provides that service, or you can monitor it at home. You could buy one of the machines and keep like a log of all your blood pressure. And these are more realistic because you can take it at your convenience, you can take it at any time of day, and that's what you use to establish what you call a true blood pressure reading. One that's not affected by being in the doctor's office or by anything else. And it's most effective when you use everything together, preferably going to the doctor, taking the blood pressure there, taking it at home, and taking it actually in a community pharmacy setting because of what that has to come with, which I'll talk about. Ambulatory, meaning you walk in, walk out. Blood pressure monitoring. Community pharmacy setting is the most common, and the advantages of that, you can take multiple readings. You can ask the pharmacist for, they'll take it once. If the pharmacist notices that it's not right or something's weird about it, you can take it again as many times as you need. And the biggest thing here is that you're in the presence of a healthcare professional other than your doctor. Because having a pharmacist around, he can interpret your results. He could say, it's high, is it usually high, or maybe it's high because of this. Like, you never know. They probably walked the 7 blocks to get to your pharmacy, which is might be it's high. But if the patient takes it by themselves and notices it's high, they might not think of all the factors that actually contribute to high blood pressure. And also, biggest advantage is that it's accessible. There's a pharmacy like every other block now you go. It's either one of the chains or an independent that provides a service. Disadvantages, not everyone can benefit from a community pharmacy setting because of like special needs, or if they're not like all that fit to walk to a community pharmacy, or if they don't drive or anything. You still have a certain risk of anxiety with certain populations, and also the risk of changing treatments without medical providers. Risk of changing treatments without medical providers' guidance. If a patient walks in to a community pharmacy and notices that today their blood pressure is controlled, they might skip their medication. Pharmacists might not know that, doctor might not know that, but they might do it on their own. How is this clinically significant? There were 2 studies done in 2008, both done in Spain. The MEPAFAR and the Palmera study, both of these included treating already treated hypertensive patients diagnosed by a physician. There were 169 people in MEPAFAR, and Palmera had 70. In the MEPAFAR, community pharmacy, home monitoring, and daytime ambulatory care were compared, and Palmera was community pharmacy, home monitoring, and physician's office. Next. The MEPAFAR, in the community pharmacy setting, it was used by each patient had the same pharmacist every time at the same pharmacy, and they did 4 visits over a 4-week period with consistent scheduling, meaning like within an hour of the same time every time they made the visit. Palmera, they measured 5 visits over a 5-week period, at least 2 in the morning and 2 in the evening. This is what I was talking about, how different times of day means like different measurements. And the primary care physician, was measured by a physician during the 3 visits, all of which were in the morning, over a 3-week period. They also had 3 measurements taken at each pharmacy, as well as the physician's office. At home, the patients monitored their blood pressure over 4 consecutive working days, 3 in the morning and 3 in the evening. And the thing about this, all 3 of these settings use the same machine, whether it was in the doctor's office, the community pharmacy, and at home. So everyone was provided this machine, which is It's actually this model right here, and the biggest thing about this, they wanted to keep everything consistent. So it didn't matter whether you went to a community pharmacy or you test at home or even the doctor's office. Even the doctor used this, just to keep kind of like a consistent reading of results. So what does all this mean? Pretty much the whole, to sum this up, the main findings that we could get from both of these tests is that actually when used in conjunction with just the primary care physician, you want to monitor as much as you can and in as many different ways as you can. Obviously, everyone should monitor at home. If you have a risk of, or you actually have diagnosed hypertension, you should always monitor at home and keep like a record. And you should also do it in an ambulatory setting, whether it's a community pharmacy or like a nursing home or anything that provides that service. So you can also have someone who takes the reading for you, just to make sure you're doing it right, and to interpret those results. And this is what they kind of established, like an algorithm as to what you should do, which we won't go into, but pretty much if they notice that it's different after the first time or second time, what to do about it, and how you should go about advising them to maintain their blood pressure. And the role of a pharmacist, finally. Like I already said, interpret your results. Now, again, not everyone knows how blood pressure is affected. So when they come into your store and they get a reading, you're not going to just tell them, oh, it's 130 over 90, you're pre-hypertensive. But actually, you as a healthcare professional know to ask them the questions like, did you walk here? Did you have your morning cup of coffee? Are you on any other medication, or did you skip your medication today? And maybe there's a lot of stuff that goes along with the blood pressure reading. And also you can provide recommendations, whether you go see your doctor or how to take your medication. Maybe something you're taking in your regimen is off. You're taking a couple pills at the same time and you don't know it, and the doctor might not know it, and it's skewing your results. So as the healthcare professional, you're kind of there to translate what a blood pressure reading actually means, because not everyone always knows the number they see is the right number, but they'll take it for face value, and you got to kind of tell them what that actually means. And that's that.